Guidance is advised.
We're working to connect a region of over 600 cultural bridges between our lands.
Good afternoon, I'm Alma Angeles. Welcome to ASEAN in Focus. We're coming to you live from Manila and Vietnam. Hello, Ralph.
Good afternoon. Hi, Alma. I'm Ralph Pandolf Empire from your EBC Vietnam Bureau to give you the latest updates in ASEAN dynamic region.
On today's headlines, the Association of Southeast Asian Nations urged an immediate end to violence in Myanmar and for the junta to allow a special envoy tasked with facilitating talks to visit as soon as possible.
President Duterte is currently observing mandatory quarantine protocols after exposure to a household staff who tested positive for COVID-19.
A French judge has ordered 2 security aides for Cambodian leader Hun Sen to stand trial over their role in a 1997 grenade attack that killed 16 people.
The Department of Health or DOH on Wednesday reported a rise in COVID-19 cases among children aged 5 years old and below.
First in our news, the Association of Southeast Asian Nations urged an immediate end to violence in Myanmar and for the junta to allow a special envoy tasked with facilitating talks to visit as soon as possible. The bloc called for the immediate cessation of violence and for all parties to exercise utmost restraint in a statement released by Cambodia, the current chair. It added that its special envoy, Cambodia's Foreign Minister Parak Sokhon, should also be allowed to visit the country as soon as possible to meet with all parties concerned. It made no mention of ousted civilian leader Aung San Suu Kyi, who has been detained since the coup and faces a catalog of charges in a junta court that could jail her for more than 100 years. In a speech marking the coup anniversary on Tuesday, Min Aung Hlaing said the junta had discussed the ASEAN and UN special envoys to the country, according to state newspaper Global New Light of Myanmar. But he added any cooperation with the international community would be done without harming the sovereignty of the state, national interests, and the future plans of the government. The 10-nation regional bloc has led diplomatic efforts to end the chaos unleashed in Myanmar by coup last year, which triggered mass protests and a deadly crackdown on dissent. But violence has continued with anti-junta groups clashing regularly with the military, and the World Bank warning Myanmar's economy had likely contracted by almost a fifth last year.
The UN Security Council called Wednesday for an immediate cessation of all forms of violence in Myanmar and expressed hope that a special envoy would be allowed to travel there to mediate the crisis. The Association of Southeast Asian Nations wants to send its representative, Cambodia's Foreign Minister Prak Sokhon, to Myanmar, where last year's coup triggered mass protests and a deadly crackdown on dissent. The UN Security Council looks forward to the minister's visit to Myanmar at the earliest opportunity to meet with all parties concerned and carry out mediation that facilitates the dialogue process, as well as the provision of humanitarian assistance, the body said in a statement. In the statement drafted by the Britain and passed unanimously on the first anniversary of the deadly coup, the Council expressed deep concern at further recent violence in the country and expressed alarm at the large numbers of internally displaced. More than 1,500 people have been killed by security forces and more than 11,000 arrested since the coup, according to a local monitoring group.
Meanwhile, the United Nations has also appealed for $826 million to meet the needs of 6.2 million people in Myanmar this year. This is the largest appeal ever for the country. That is according to Jens Lark, spokesman for the UN Office for the Coordination of Humanitarian Affairs. Take a look.
The 2022 Humanitarian Response Plan for Myanmar has been published, requesting a record $826 million to reach 6.2 million people with assistance this year. The plan this year is more ambitious than last year's, asking more than twice the amount, and it reflects the growing crisis that has plunged an estimated 14.4 million people across the country into humanitarian need. 5 million of them are children.
The United Nations estimates that out of 54 million people in Myanmar, 25 million are already living in poverty. 14.4 million need humanitarian aid, including 5 million children. He also called for humanitarian agencies to be allowed access to displacement sites to deliver life-saving food, water, and health care. Again, let's listen in.
Conflict and insecurity is raging in many parts of the country, and more than 400,000 people have been displaced since the military takeover 1 year ago today. Thousands of displaced people are living in appalling conditions, many in camps and displacement sites, others with host communities, and some have crossed the borders with Thailand and India, or have sought refuge in the jungle without adequate food, shelter, sanitation, protection, or medical care. The economic and political turmoil of 2021, combined with the devastating impact of COVID-19, has driven half the population into poverty. Many can no longer afford to feed their families because of job and income losses and price increases. Over 13 million people are moderately or severely food insecure, and malnutrition is expected to worsen among children unless we support the parents to provide enough nutritious food for their kids.
Myanmar's self-proclaimed shadow government has been nominated for the 2022 Nobel Peace Prize. The Norwegian lawmaker behind the proposal said on Tuesday, the anniversary of the military coup that deposed Aung San Suu Kyi. The National Unity Government, which claims to be the country's legitimate government, was formed last April and is made up of dissident lawmakers in hiding or exile, many of them from ousted leader Aung San Suu Kyi's party. Several months earlier, on February 1, the junta had grabbed power by alleging massive fraud during elections in late 2020, which Suu Kyi's National League for Democracy won by a landslide. Suu Kyi, who won the 1991 Nobel Peace Prize, has been under house arrest at a secret location since the coup, ending a brief democratic interlude for the country. The coup has plunged the country into chaos. More than 1,500 civilians have been killed by security forces, according to a local aid organization. The deadline for Nobel Peace Prize nominations was January 31. This year's winner will be announced in early October.
And it's been 1 year since the army seized power in the Southeast Asian country. Hours before a new parliament was due to convene, troops rounded up lawmakers in dawn raids, ending a brief democratic interlude, setting the stage for months of bloodshed. Let's hear some of the reactions. Take a look.
ဒီ taste ကိုသိသွားပြီပေါ့နော်လူငယ်တယောက်အနေနဲ့ကဒီ taste ကိုသိသွားပြီဒီ freedom ကိုသိသွားပြီဆိုတဲ့နောက်မှာအဲ့နောက်ကိုပဲညီမတို့လိုက်ချင်တော့တယ်ဒီဘက်ကိုညီမတို့ပြန်ပြီးတော့ဒီတွဲနဲ့ကြီးရောညီမတို့ပြန်ခုံမစင်းချင်တော့ဆိုတော့ဒီစစ်အာဏာရှင်အုပ်ချုပ်တဲ့ဒီအောက်မှာဒါနေရမယ်ဆိုလို့ရှင်တော့ကိုကခုနပြောလို့ပဲရှင်နဲ့ပဲတိတ်နေမယ်ထင်တယ်ကိုဟိုညီမတို့မှာကဘာအခွင့်အလမ်းဘာအခွင့်အရေးမှမရှိတော့ဒီလိုဖြစ်သွားမှာပေါ့
ဘာလို့ကိုရဒီရီမန်ချက်ဒီငါဘာလို့မနောက်နှစ်ဘာလို့မဆိုတော့ဟိုအဲ့လုံးစားရတော့တယ်ကျွန်တော်ဘေးရောက်တော့ဆိုဒီချင်းရနေဘယ်လိုမျိုးဒီချင်းဒီမှာရှင်းတောင်ဘယ်လိုနေထိုင်လဲဆိုတဲ့အခြေအနေရောက်တော့တယ်ပေါ့နော်တောက်လျှောက်တစ်နှစ်ဒီအခုဆိုရင်လာမဲ့ February တင်နေတာဒီအာနာတင်တဲ့တစ်နှစ်ပြည့်ပေါ့နော်အဲ့တစ်နှစ်လုံးတကယ်ကိုဟိုငရေလူပြောလို့ရ
French judge has ordered two security aides for Cambodian leader Hun Sen to stand trial over their role in a 1997 grenade attack that killed 16 people, a source close to the case said on Wednesday. The attack targeted Sam Rainsy, a longtime opponent of strongman Sen's rule, who is also a French citizen and has lived in self-exile since 2015 to avoid prosecution in Cambodia. Judge Savine Paris ruled that Hui Bisset and Hing Bun Yang, the former chief and deputy chief of Sen's bodyguards unit, should stand trial based on the unanimous conclusions of inquiries by the U.S. Federal Bureau of Investigation, the United Nations and Human Rights Watch. Hing Bun Yang, now 65, is believed to have hired the attackers and Hui Bisset, 66, to have helped facilitate their escape after throwing the grenades. The grenades, which wounded another 150 people but did not kill Rainsy. The two men face charges of complicity in murder, according to the judge indictment order of December 30, after French arrest warrants were issued in 2020. However, no date was set for trial and the suspects are not in France. Rainsy, who obtained a French passport in 1974, initially filed his complaint in Paris in 2000 but dropped it after returning to Cambodia in 2006. His continued activism against Sen's regime led to further self-exile in France, and he obtained a new inquiry into the 1997 attack in 2012. Sen, a 69-year-old former Khmer Rouge cadre, is one of the world's longest-serving leaders, maintaining a 36-year grip on power with methods that critics say include jailing political opponents and activists.
To other news now, Cabinet Secretary Carlo Nograles and acting presidential spokesperson said that President Duterte is currently observing mandatory quarantine protocols after exposure to a household staff who tested positive for COVID-19. Nograles said the president has since been tested for COVID-19, and while the results of the test came back negative, he's currently observing mandatory quarantine protocols. Nograles also said the president's last day of exposure to a COVID-19 positive case was last January 30. Now, he said his RT-PCR test or negative test result was last Monday, January 31st, and tested negative again for the second time on Tuesday, February 1. Nograles said the president is still in constant communication with cabinet members to ensure that urgent matters are addressed while in quarantine. In a separate message to reporters, former Chief Presidential Legal Advisor Salvador Panelo said the president is, quote, busy with paperwork in the Bahay ng Pagbabago in Malacanang. The news continues here on ASEAN in Focus. Ralph and I will be back right after this.
sa Season 2 ng Lingap Stories tuwing Linggo, alas 5 ng hapon sa Net25.
Sila ang mga dapat mong hanapin para tulungan ka maging fit and healthy. Hey! Sino kukuha sa inyo magta-train sa kanila? Puro kay chichiri-kiri! Alin sa mga sumusunod na hayop ang hindi nakakatalon? Agad-agad. Okay, Vince. Kaya na may papasa yung tanong na yan.
Kay Coach Job.
Bakit mo pinasa kay Coach Job?
Tingin ko po hindi niya masasagot.
Tingin mo hindi masasagot to, no?
Rock and roll!
Rock and roll, Job! Agad-agad. Coach Job, kayo na may papasa.
Hindi, babawi ako kay Coach Vince.
Babawi kay Coach Vince. Tama! Mainit ng mainit ang labanan natin dito. Ito ang Tara Game! Agad! Agad! Bakit kayo naka-jacket? Bibigyan ko pa naman kayo ng jacket. Bigyan ng jacket yan! Wala kami yung jacket.
We're open for business, giving MSMEs the latest market trends and business opportunities. Open for business, only on Net25.
This week, we have again 3 beautiful dishes na enjoy po ako na i-share po sa inyong lahat. Clam chowder. Yes, clam chowder soup. Ang ating pangalawang dish naman, ito ang tinatawag na frittata. Eggs Benedict with hollandaise sauce. Alam nyo, okay na ako dito. Kung ito yung dinner ko or lunch ko or breakfast ko, okay na sa akin to.
Mata ng Agila Primetime News welcomes veteran journalist Alex Santos with over 25 years of experience in broadcast journalism. Handang magdagdag ng lakas at puwersa sa pangkat ng mamamahayag ng Net25. Para sa mata ng Agila, matapat, matapang, matatag.
Sa ating pong lipunan, hindi na mawawala ang mga samot-saring problema. Kaya tuloy lamang pong pag-aksyon, paghahanap ng solusyon. Lalo na ngayon, may maaasahan ka ng re-responde. Sabado, alas 6 hanggang alas 7 ng gabi. Ito ang Responde, mata ng mamamayan.
Hindi ka natatakot sa akin?
Para sa mga taong mahilig mangutang pero hindi marunong magbayad.
Dyan! Paano kanila pagkakatiwalaan kung nakaw ang couple necklace?
Kailangan mabalance nyo ang batsa. Tatanggalin nyo ang medyas isa-isa.
Malalayong lugar ang kanilang narating para maghanap buhay. Tulungan ang pamilyang iniwan sa sariling bayan. Yan ang ating mga overseas Filipino worker. Pero dahil sa di pangkaraniwang pangyayaring hatid ay krisis, may ilan sa kanilang nagpasyang umuwi. Pinagyaman ang sariling lupain, nagtayo ng negosyo na kasama sa puhunan ang sipag at tiyaga. Ang mga OFW, maraming sakripisyo, ninanais maging kapaki-pakinabang maging sa kanilang pagbabalik bansa. Sapagkat ang ating mga bagong bayani, Pilipino pa rin sa puso at damdamin.
Ang morning show na always nagbibigay ng ngiti at saya sa bawat kada all over the world. ma-inspire at ma-amaze sa kwento ng mga bawat kada na nagwagi sa anumang hamon at pagsubok ng buhay. Itago ng mga remote control at tumambay lang dito sa paborito niyong barkada sa umaga, ang Kada Umaga! Dahil kayo ang bida dito.
Welcome back in ASEAN in Focus. Now let's get the latest coronavirus situation here in Vietnam. Joining me live here today is Ralph Clarence Kailao. Hello, Ralph. Please go ahead.
Hello, Ralph. Good afternoon. This is the latest news here in Vietnam. On Wednesday, Vietnam verified 8,722 new COVID-19 domestic cases in 55 provinces and cities, the lowest in the past 72 days. Hanoi with the most cases of 2,716, then Da Nang with 778, and Thanh Hoa with 353. There were no new deaths reported on Tuesday, bringing the country's COVID-19 toll to remain at 37,780. On the same day, 6,795 patients successfully recovered, bringing the total number of recovered patients to 2,068,853. Over 2.36 million cases have been verified in the fourth wave, which struck the country in the late April. To date, Vietnam has reported 186 occurrences of the Omicron variant, 22 which have occurred in Ho Chi Minh City. So far, 74.1 million people have received 2 doses of the vaccine, while 28.3 million have received 3 doses. That's the latest report here in Vietnam. Back to you, Ralph.
Thanks for your time and for your updates, Ralph. Please keep them coming. Always stay safe and healthy.
Thank you, Ralph. Likewise, I'm Ralph Clarence Kailao, reporting live from Ho Chi Minh City, Vietnam. We live in interesting times.
The Philippines coronavirus risk classification is down from high critical to moderate according to the Department of Health. Here's Health Undersecretary Maria Rosario Verger. Take a look.
Ang graph dahil unti-unti na pong bumababa ang mga kaso ng COVID-19. Kaya naman po, bumababa na rin ang ating national positivity rate. Makikita po sa isang graph, ng graph na ito, ang blue line na nagre-representa ng pagbaba ng COVID-19 cases, habang ang red line naman po ay tumutukoy sa ating positivity rate. Mababatid sa graph na mula sa 46.8% peak noong January 18, ang positivity rate natin ay bumaba na sa 35.4%.
Very clear naman yung pagbaba. Actually, it's very steep. And considering nga na puro B2 to, BA2, which is considered to be about 25 to 30% more infectious than BA1. And so what that really tells us, this is for NCR, na maganda talaga yung pinakita na proteksyon ng ating mga bakuna. And in these cases, as Yusek has said, hindi naman na severely overwhelm yung ating healthcare system, and katunayan is mukhang pababa na rin talaga yung ating mga ICU hospital bed capacity. So the bottom line is ngayon I think na nakikita rin ng mga tao yung Denmark nagbubukas na. Nagtatanggal na sila ng masks and everything. In fact, pataas pa yung cases nila pero dahil nakita nila yung pagbaba ng ICU utilization, ang reasoning nila dito is with the vaccination, it's no longer the same disease that it was noong 2020 na up to 10% of the vulnerable population can die. So na-transform na po natin yung COVID into something that is closer nga to the flu if you are vaccinated. And so that is really the trick.
The Philippines has so far reported 3,577,298 confirmed COVID-19 cases since the outbreak began, of which 160,297 are undergoing treatment. 3,362,904 have recovered and 54,097 died.
Staying in the country, the Department of Health also reported the rise in COVID cases among children aged 5 years old and below. Again, here's Yusek Maria Rosario Vergere from the Department of Health.
Bagamat nakikita nating bumababa na ang bilang ng mga kaso sa iba't ibang age groups, tumaas naman po ang mga kabataang mas bata sa 5 taon gulang kung ikukumpara po nung tayo ay nagkaroon ng Delta situation. Kung titignan po natin ang graph na ito, pinapakita po in general may pagbaba sa kaso ng COVID-19 sa mga 60 years old at pataas. Nagkaroon lamang po ito ng kaunting increase ngayong January. Sa kabilang banda, makikita na nagkaroon ng pagtaas sa kaso ng COVID sa ating pediatric age group kung ikukumpara po natin ito noong Setyembre na meron tayong Delta experience. Lumalabas na may pagbaba sa proportion ng mga kaso ng COVID-19 sa 12 to 17 years old, pero may pagtaas naman po ng proporsyon ng mga kaso sa 5 taon gulang at pataas. Mula po sa average na 35%, tumaas ito ng bahagya sa 37% nitong Enero. Gayunpaman, hindi po tayo dapat mangamba dahil patuloy po ang kagawaran ng kalusugan sa paggawa at pagpapatupad ng mga measures at protocols upang mapigilan pa natin ang paglaganap ng virus at upang masigurong protektado ang ating mga mamamayan. Kabilang na rito ang pagbabakuna sa ating mga nakakabatang populasyon.
Parents and guardians to get their children inoculated as soon as possible. Children aged 5 to 11 years old may start getting their vaccines on February 4. The DOH will be rolling out the inoculation in pilot vaccination sites in Metro Manila. She also emphasized the absence of data suggesting vaccines cause death.
Lahat po ng mga bakunang hatid ng gobyerno ay garantisadong ligtas at epektibo para sa proteksyon ng ating mga anak. Pinapaalalahanan po natin ang mga magulang na hindi po kailangan mangamba dahil ang mga adverse events following immunization or AEFIs ay rare at batay rin sa kasalukuyang global data. Sa 8.1 million vaccinated children, 11 lamang po ang verified cases ng myocarditis. This is 0.00013% of the total vaccinated children. Napakaliit na porsyento po ito, napaka-rare pong mangyari. Gayun din, walang datos ang nagsasabing maaring maging sanhi ng pagkamatay ang bakuna.
Presidential Advisor for Entrepreneurs, Cape Joey Concepcion, likened the COVID alert level to typhoon signals in moving out from the alert level system as he explained his exit plan from the pandemic.
Do we have a typhoon signal raised every day in our country? We don't, right? It is only when we have a typhoon that is coming in do we either put it to signal number 1 or number 2 or number 3. But in our case, if we feel that the cases are going down, and it is going down, and that things would be relatively safe, there is never going to be a perfect situation with for as long as COVID still is lurking around. So we should open up. Now, if and what do we mean by no alert level? In other words, your basic minimum protocols, no? Wearing a face mask, so level of social distancing, all of that, no, that we are doing now, that we have learned to do. If we feel bad, let us not go to work. Let us stay home and check if we are sick. No? And if we're sick, then we get well at home. So people will voluntarily quarantine themselves, no? And the companies will understand that as well, no? So that is what I mean by getting rid of the alert level, no? Because if there is no threat and Omicron is going down and there's no variant, then why put even an alert level 1? Allow all to open, allow the coliseums to open, allow the concerts to start. But again, you practice the minimum health protocols. If social distancing is one of them, then so be it. Allow social distancing and set the parameters for that. No? So when we say we don't need the alert level, we don't need it when the cases go down. So you set that aside. What you adopt are your minimum health protocols. So it's like a typhoon. We're not going to raise a typhoon if there's no typhoon. So we raise it up when there is something. So we cannot live with alert level 1 as the bare minimum. Para tayong we're naman 22 months, hindi pa tayo, we don't know how to live with this threat. Now, yes, there could be always a new variant that will come out. Nobody will say that. But let's look at the more optimistic side. Let us not set up an alert level 1 just to prevent that new variant from coming in. Omicron, we could never stop, no? Not even locking the borders stopped the Omicron from coming in. So it hit us, no? And we just survived it. So I think that is how to learn, no? To live with this virus. And what is at stake right now is the economy. And let's face it, no? We're not as rich as America and other European countries. We have borrowed so much money to fund all of these health initiatives and vaccines, to testing kits, and that's trillions. You will never get a return on that. What you prevent is people from dying, basically, and keeping them healthy in the country.
Concepcion also highlighted the critical role of COVID-19 vaccines, including booster shots, to provide protection for Filipinos against the infection. He added the private sector is doing its part on vaccination campaigns by inoculating workers and their household members, and by also giving booster shots.
Meanwhile, the Indonesian government has reduced the quarantine period for international travelers to 5 days from 7 days earlier. The step was taken in response to a rise in the number of cases from local transmission, according to Coordinating Minister for Maritime Affairs and Investment, Luhut Binsar Panjaitan. Mr. Panjaitan noted that the Indonesian nationals that had received their first dose of COVID vaccines must undergo a 7-day quarantine upon arrival from abroad, and this is because the variant of COVID-19 that infected most of international travelers is Omicron. Furthermore, various researchers also suggest that the incubation period of this variant is about 3 days. Now, the step to lower the quarantine period has also taken into account the need to reallocate the government's resources.
Tens of thousands of tons of extra medical waste from the response to the COVID-19 pandemic has put tremendous strain on healthcare waste management systems around the world, threatening human and environmental health and exposing a dire need to improve waste management practices, according to a new WHO report. Let's listen in.
The report is an analysis of healthcare waste in the context of COVID-19, and we really use COVID-19 as an opportunity to take a closer look at the volumes of healthcare waste that were being generated during the pandemic and what facilities, what countries, and what the global community was doing about it. The report is really focused on healthcare facilities and health systems, and there, of course, our concern is the health workers, needle stick injuries, spread of other infectious agents, but also in particular the burning of waste, which leads to furans and dioxins, which are carcinogenic and can be really harmful, not only to health workers, but the surrounding communities. But we also note some of the bigger concerns because the volume of waste that's being generated is largely being driven by what the public is doing. So things like disposable medical masks are potentially having a massive impact, not only on waste streams, but the environment at large. There's a lot of existing solutions, and they're all based on the circular economy and thinking about how we can reduce waste in the first place. So the number one item is not to use PPE that's not needed. Gloves are not needed, for example, for vaccinations, and they're not needed for a lot of medical interactions, let alone by the public. So if we could reduce gloves in countries like the UK, we're already having a gloves off campaign before COVID-19, that would be fantastic. The second recommendation is to think about the packaging. The packaging is leading to a massive amount of waste, and if we can shift towards more paper-based packaging and less single wrapped items, that would have a big impact. Another important recommendation is to think about recycling and segregation and how things like masks and other PPE can be safely reused, for example, for road and building construction materials. And the last recommendation is really for governments, but also the global health community. We can no longer ignore healthcare waste. We need to invest in the people, into the training, into the waste workers, but also to the safe treatment through autoclaving and other non-burn technologies, and eventually to looking at these bigger schemes where we can recycle non-infectious waste and use it for other uses.
Back here in the country, the Department of Health told laboratories and hospitals to dispose of their medical waste properly amid reports that 7 children caught COVID-19 after playing with garbage dumped by a diagnostic center in Catanduanes against the Thistlein.
Ito, kumakalat. So unang-una, gusto ho namin paalalahanan lahat ng ating laboratorio, lahat ng ating facilities. Meron ho tayo mga batas na sumasaklaw sa mga ganitong violations. Meron din po tayong mga polisiya to guide you on what you're supposed to do regarding this medical waste. We are not going to tolerate this kind of irresponsible behavior kasi maaari po ito makasakit o it can cause harm to our other citizens within our nearby their area. So pinapaalalahanan po natin ang laboratories, ang ating po mga ospital din, ang ating local governments, please dispose of your medical waste properly. Kasi pag hindi po natin ginawa yan, maaari pang kumalat ang ibang sakit ito sa ating bansa. Pangalawa, kailangan gusto lang ho namin klaruhin kung sakasakali po ng mga hiringgilya yan o hiringgilya man ng bakunahan. Unang-una, laboratorio po ang pinanggalingan. So yun pong posibilidad na maaring COVID-19 vaccine yan, ay maaring hindi. Pangalawa, katulad nga ng sabi ng mga eksperto natin, ang COVID-19 vaccine natin, hindi po siya live virus. So kung sakasakaling meron mang makapagtapo ng hiringgilya at nahawakan ng ibang tao, katulad ng mga batang yan, yung posibilidad na mahawa sila ay napakaliit.
Definitely po yung ating mga bakuna, hindi po sila nakakahawa, hindi po sila nakakapagdulot ng COVID at hindi po sila magre-result in a positive COVID test. Kasi yung ating mga bakuna right now, yung meron po tayong inactivated virus or patay na po na virus. Number 2, yung mga mRNA na hindi naman po virus, hindi naman po buong virus yon, yung mga spike protein, ganun rin po. At yung mga naman po, yung viral vector, yung Astra, yung Janssen, hindi po ito nagre-replicate at hindi po siya makakapagdulot ng COVID. So as far as we're concerned po, yung ating vaccines are safe and are not able to cause a positive COVID test or cause any kind of COVID po.
Stay tuned. We'll be back with more news after the short break.
Alam namin ang iyong pagsisikap. Dama namin ang iyong mga sakripisyo. Kita namin ang pagharap mo sa bawat pagsubok. Kaya sa kabila ng mga hamon ng buhay, nandito kami para umalalay. Kasi katulad mo, gusto rin namin ang magandang bukas para sa kanya. Hatid namin ang dekalidad na edukasyon at makabagong pasilidad sa abot kayang halaga. Kaya huwag ka na mangamba. Sasamahan ka namin tuparin ang mga pangarap niya. maaasahan mong sulit dito ang mga pinagsikapan mo. Sa aming mga makabagong pasilidad at sistema ng edukasyon. May lalabas natin ang aking talino at mga kakayahan niya. Kahit sa munting halaga, makakasiguro ka na makakasabay siya sa mabilis na pag-ikot ng mundo. Sa New Era, karamay mo kami sa bawat hamon. Kaagapay mo kami sa bawat hakbang. Kasama mo kami sa bawat ngiti at tagumpay.
Welcome back to the program. The Department of Agriculture has slapped a temporary ban on poultry from Spain and Croatia and pork products from Italy due to the outbreak of animal diseases in the European countries. In separate memorandum orders, IT issued on Wednesday, the DA said wild birds and their products, including poultry meat, day-old chicks, eggs, and semen from Spain and Croatia are not allowed to enter the country in the meantime due to the outbreak of the highly pathogenic avian influenza, or HPAI. The bird flu outbreaks were confirmed by Laboratorio Central de Veterinaria de Albacete of Spain and Croatian Veterinary Institute Poultry Center of Croatia. The agency warned that wild birds and poultry products from Croatia will be confiscated. The DA also announced the temporary ban on the importation of domestic and wild pigs and their products, including pork, meat, pigskin, processed animal proteins, and semen from Italy. This came after the National Reference Laboratory for Classical and African Swine Fever confirmed that there was an outbreak of African swine fever in Novara, province of Alessandria, northern Italy. The DA also ordered the suspension of processing and issuance of sanitary and phytosanitary import clearance for the said agricultural imports from Italy. The said commodities from Spain are still allowed to enter the country if they were produced or slaughtered before December 30, 2021. The cutoff production date, meanwhile, for shipments from Italy is December 23, 2021.
We go now to the Asian markets. They were mixed today with a split between those suffering from profit-taking following a recent rally and those that were playing catch-up after a midweek break across much of the region. Wall Street provided another healthy lead after rising for a fourth day, helping pare January's steep losses, but the positivity was dealt a blow after the close as Facebook parent Meta's sobering earnings fueled fresh worries about the tech sector. The gloomy mix of a sharper than expected drop in profit, a decrease in users, and threats to its ad business followed disappointing results from streaming titan Netflix, indicating the pandemic-era sugar rush enjoyed from people being holed up at home has come to an end. In early Asian trade, Tokyo, Sydney, Wellington, Manila, and Jakarta all fell, having enjoyed a very strong week so far. However, Singapore and Seoul were both up around 2% on their first day back after the Lunar New Year break. Hong Kong, Shanghai, and Taipei were still closed. U.S. futures turned sharply lower, with Meta plunging about 20% in after-hours trade.
Profits at Norwegian telecoms operator Telenor tumbled in 2021, the company announced on Wednesday, with its divestment from Myanmar following last year's military coup playing a major role. Annual net profits dropped from 17.3 billion kroner in 2020 to 1.5 billion kroner, or equivalent to 153.6 million euros last year, with the falling profitability of local subsidiary Telenor Myanmar accounting for almost half of the drop. The remainder of the fall was due to gains on disposals in 2020 and negative currency effects. Telenor in July said it would sell its local subsidiary Telenor Myanmar to Lebanese financial firm M1 Group after the army ousted civilian leader Aung San Suu Kyi in February 2021 and brutally repressed dissent. Media reports claim the junta is hostile to a sale to M1. Civil society and rights groups have criticized the move as they fear Myanmar's telecommunications network will be controlled by a firm more conciliatory towards the regime. In September, Telenor said the military junta demanded it install equipment to intercept communications. The deal remains subject to Burmese regulatory approval.
And Vietnam came closer to their first ever FIFA Women's World Cup after an easy 2-0 win over arch rival Thailand at the Deep Patil Stadium on Wednesday in Mumbai, India. With both teams having suffered heartbreaking defeats in the Indian 2022 AFC Women's Asian Cups quarterfinals on Sunday, the round-robin playoff was a chance to take an automatic slot in the FIFA Women's World Cup Australia-New Zealand 2023. It was Vietnam who started the brighter of the two. Vietnam didn't take long to open the scoring in the 19th minute with a shot of captain Yun Nu from the center of the box into the net. 5 minutes later, the Southeast Asian champions doubled their lead with Tai Thi Tao heading home Nguyen Thi Trung Yet Dung's corner kick. The Vietnamese team nearly scored their third 2 minutes into the second half, but the left post denied Pham Na Yen's finish, while Nu's goal was not recognized as VAR ruled it offside. Thailand, who were strongly affected by the COVID outbreak in their squad, did it better in the second half, but they could not overthrow Vietnam's dominance. Vietnam secured the win and can now set their sights on playing Chinese Taipei Sunday, February 6. And finally in our news, we have an update coming in from our EBC correspondent in Malaysia. Hello, Alfred. What is the coronavirus situation there?
Hi, Alma. Good afternoon.
Good afternoon.
According to the National COVID-19 Immunization Program for Kids or PIC Kids, the parents are not being forced to vaccinate their children. The decision will be made by the consent of all parents, and the Health Ministry added. Adults cannot enter eateries or shopping if they are not fully vaccinated, but for the children, it will be different. The children who are not yet vaccinated are not subject to the same policy. It is still the parents' decision in this case, according to the PIC Kids. However, the Health Minister said that children's protection against COVID-19 is not secure as they do not have vaccine. 50% have already registered for getting the jab. That will be the latest update from the Star, Alma.
Thank you very much, Alfred, for your update there in Malaysia. Do stay safe and looking forward for more updates coming out of Malaysia. Thank you.
You're welcome. Live reporting from Kuala Lumpur, Malaysia. This is Alfred Balmes. We live in interesting times.
And thank you, Ralph, for keeping me company today here in ASEAN in Focus. Keep safe over there.
Always a pleasure, Alma. And that's the latest news in the ASEAN region. This is Ralph Randall-Penpai from your EBC Vietnam Bureau. We live in interesting times.
And I'm Alma Angeles. We live in interesting times.